Now we come to those signs and symptoms which occur or which come up because of the brain tumor. The first is headache. Now, these headaches which come up because of the brain tumors are very peculiar headaches. They are recurrent, means they come up again and again, every day, every now and then. Secondly, they are severe in the morning, and sometimes they may wake you up from sleep because it's a severe kind of a headache. And most of them are because of the raised intracranial pressure. The second one is seizure. Now, what is seizure? It's also called as convulsions. In local language, many people call them as fits, brain fits. Now, what happens in this convulsions or seizure? Person suddenly loses consciousness. He either falls or collapses. Then there is rapid jerky movements of the hands and legs, froth at mouth, and because of pressure in the intracranial cavity, they remain unconscious for a few minutes. There is a clenching of teeth, and they regain consciousness after a few minutes, after which they might get some headache or no headache. So this is called as seizure, second prominent symptom because of brain tumor. The third one is difficulty in speaking, thinking, or even difficulty in comprehensions. So if the person has difficulty speaking and expressing with proper words, he may not be able to speak complete statement. He may not be able to place proper words. He may have difficulty in comprehending what other person is saying. Now that is because of certain particular parts of the brain which are affected because of brain tumor. The fourth one is personality change or behavioral change. That is commonly seen in brain tumors which occur in the frontal anterior part of the brain, where a person loses his daily routine habits. He becomes a different person. He becomes withdrawn from the society. He wants to be quiet. He doesn't want to talk to anyone. He probably is emotionally labile, cries or laughs abnormally. These different personality changes also may come up with brain tumors. The next one is weakness or paralysis of one part of the body, maybe one hand and one leg, or maybe part of the face also may be paralyzed because of brain tumor which is slowly growing. The next symptom is dizziness, also called as reeling sensation. That means it is as if the things around the person are moving round and round. This is because of the tumors which cause pressure over the brain and certain cranial nerves. The next symptom is visual abnormality or diminished vision. Sometimes it can cause blindness in either one eye or both the eyes slowly over a period of time. And that's how we know that there's a pressure built up in the brain compressing the optic nerves which are responsible for our vision. The next symptom is deafness, because of the specific nerves from which the brain tumor can come up. And if they are located or situated on the nerves which are important for hearing, cause deafness. So deafness also, a progressive deafness also is one of the symptoms of brain tumor. The next symptom is nausea and vomiting. This nausea and vomiting or sensation of vomiting or actual vomiting is because of the increased intracranial pressure. Many times after vomiting, most of the headaches disappear. This is a very crucial sign in increase intracranial pressure. The next symptom is confusion and disorientation. Person may be confused and may be disoriented also. Disoriented to the place where he is. Disoriented to the person. He doesn't know who is this person I'm talking to. And sometimes they are disoriented to the time. They don't know whether it's morning, evening, afternoon or night. So this disorientation comes up because of the brain tumor which is slowly growing in the brain. Now the next question to all of us is why these brain tumors? How these brain tumors come up in brain? Now let me explain to you what it is. Human brain has billions of cells and they are of different types. Now take one cell, one neuron. Now what happens? In this particular cell, there is one nucleus. And in the nucleus of the cell, there is what is called as genetic material present in the form of chromosomes. Now on these chromosomes, there are DNAs and RNAs. And on top of that, there are genes which carry a lot of genetic information about that particular person, cell, metabolism, so on and so forth. Now what happens? This particular genetic material or genes, they direct and give orders to the cell about its function, also about its multiplication, division. Also genes and the nucleus and the chromosomes direct cell about its longevity, when to die. So all those controls are there in the genes. Now, for some reasons which are not known to us, there is some error in multiplication or damage to some part of the gene or the chromosome, that their function is lost or their function becomes altered. And then what happens? Then there is a generation of wrong and different signals given to the cell. So the cells which are getting these wrong information, they develop, multiply differently, and then they have difficulty in continuing to generate the cells of the same order. Now, because of the different cells which are come up as a wrong or cell which is not in order, it becomes a cell which multiplies and forms a mass or a tumor which is not useful for the body. So whenever these cells of abnormal type grow because of the wrong signals, they don't die fast, they multiply very fast, and it is all nothing but brain tumor. It is now the basic reason I have already explained to you, but apart from those, there are some other reasons of the brain tumors. The second one is certain persons are born with abnormal gene, and then there is, or probably there is sudden change in their chromosomes or the genetic pattern, and that leads to formation of brain tumors. Thirdly, there are some environmental factors where there is exposure to the heavy radiation from X-rays to the cells of the body, sometimes which happens in radiation treatment given to cancer patients. Also, the mobile radiation which we get from our cell phones can also alter and damage the genes and create these brain tumors. Some of the abnormal genes come from parents into the offspring and get passed on to the next generation. So some people are born with abnormal genes coming up from their parents and they are inherited. And that's how these brain tumors or tumors come up in those patients. So this is all about signs and symptoms and why and how these brain tumors come up. Thank you.